Hi all, good evening. So in today's Cancer to Canwin talk show, we are going to discuss about something very important. Before getting into the talk show, I would like to give a brief description about this talk show, like what is the purpose of this. So the Cancer to Canwin talk show, it generally aims to spread cancer awareness among the public, to prevent cancer, how to treat the cancer, and how to diagnose a particular cancer, and what are the different treatments available. So, in order to find all these, we are bringing experts like oncologists, pathologists, researchers, and we are discussing about this in a wide platform like this. So, today's talk show is about pediatric cancer. The most disheartening thing, statistics which I recently found, every year over 3 lakh children are diagnosed with cancer all over the world. And in India alone, 50,000 cancers are being registered and it is occurring every year. So whenever I visit hospitals, I was deeply intrigued like why children are getting cancer, what are the reasons behind it, and what are the treatment options available. In order to know about it in a detailed manner, we have an expert oncologist, Dr. Anil Sharma, with us. He is a pediatric oncologist and hematologist from Apollo Medic Super Specialty Hospital, Lucknow. Dr. Anil has done his graduation MBBS and post graduation MD Pediatrics from IIMS BHU Varanasi. He was awarded the fellowship in Pediatric Hematology-Oncology and BMT in July 2018. Then he continued to work on an Indian Academy of Pediatrics Fellowship in Pediatric Hemato-Oncology and BMT at Medanta Gurgaon. He worked at 𝐾𝐲 Lucknow as a senior resident in the Pediatric Oncology Department. Later, he was trained in hemato-oncology, pediatric hematology, and bone marrow transplantation in 𝐻𝐿G Lucknow. So, during his fellowship or senior residency training, he was actively involved in the care of children with blood and cancer disorders and those undergoing BMT. He was trained in managing the children with both benign hematology disorders like thalassemia, sickle, bone marrow failure, primary immune deficiency, hemophilia, and other bleeding disorders, and thrombosis, and malignant disorders like leukemia, lymphoma, brain tumors, neuroblastoma, and other solid tumors. Dr. Anil Sharma has a good exposure to bone marrow transplantation during fellowship training. He has a good experience in matched sibling donor and haploidentical donor BMT for various malignant and non malignant disorders. So, welcome, Dr. Anil Sharma, to the show. And thank you for being
Thank,
a part of this talk show.
thank you so much for inviting. As we know, nowadays cancer either in the adult or pediatric age group is very disheartening, as you already described. So now come to the point. So please, what we want to know about. Hello,
Yeah. Doctor, can you please be a bit louder? I mean,
hello. Yes.
yes, doctor, now I am
Huh.
able to hear you.
Yes.
So the my first question, doctor, to you. So this, like as we already said in the beginning of the talk, so it's very disheartening, and I'm deeply intrigued, like why this childhood cancer is first of all happening. Is it because in generally, if we see adults, we may say because of lifestyle habits or something, but why it is happening in small children? Is it genetic or something? What is the reason?
See, most of the pediatric tumor, either it is malignant or benign or either solid tumor, have unknown etiology. Like in adult, suppose that someone is smoking, then there is a lung cancer. Someone is drinking, it caused the liver cancer. But in pediatric age group, most of the cancer etiology is unknown. But some environmental factor, radiation factor, and very minimal is genetic factor like gene mutation is cause for the pediatric tumor. But there is no hereditary pattern. Like suppose that someone have a pediatric tumor like a blood cancer, it doesn't mean his or her father have a same tumor. Only few cancer like retinoblastoma have genetic predisposition. Means suppose that the parents have a retinoblastoma, it is a eye cancer. Then it predisposed to her or his children as a retinoblastoma. Only minimal tumor have a genetic predisposition. Otherwise, most of the cancer pathophysiology and cause is unknown, like in the adult.
Okay.
Yes,
Hello.
yes, yes,
Yes, doctor. So that is the question. So it is, as you said, it is like unknown when it comes to children, right? So,
yes,
uh,
most like.
yeah. Okay, doctor. So how can a child cope up for the treatment? Because generally adults themselves, they find it very difficult to cope up for the treatment. So how are they coping up with, and what are the different treatment options available for children?
Generally, whenever in medical field, like the adult, there is a medical oncologist, and like pediatric, there is just subspecialty pediatric oncology and hematologist. And most of the metro cities like Delhi, Mumbai, Kolkata have this type of specialization. But like second tier
Sorry to
cities,
interrupt you, doctor. I mean, can you please be a bit louder? And
yes, yes, yes. Hello.
yes, sir. Yeah.
Yes, so as I said that in the metro cities, the pediatric oncologist is easily available. But second tier cities like Indore, Bhopal, or cities, there is a difficulty to approach the pediatric or hemato-oncologist. But nowadays, day by day, the number of doctors is increasing, and treatment option, if the we broad category like adult surgery, radiotherapy, and all the things, the same pattern will be follow in the pediatric age group. The one important thing is that suppose that in the someone has a blood cancer in the pediatric age group, below 18 years or 16 years, and same blood cancer in the adult age group, the possibility of the cure, which is our best aim, is more in the children rather than in the adult. Okay, and if we categorize the thing like blood cancer, like ALL, AML, the treatment option is the chemotherapy mainly, and every chemotherapy in pediatric age group is according to the protocol. Generally, for blood cancer, like in ALL, most of the center using high dose chemotherapy like BFM95 protocol. So it is a protocol based therapy. Means all over India almost equal same protocol. Okay, and some cancer like acute myeloid leukemia have very intensity chemotherapy. And if we come to the solid tumor like hepatoblastoma, eye tumor, as I told, retinoblastoma, germ cell tumor. These are the tumor of the germline mutation and other just like hepatoblastoma. So if we come to the one point, say hepatoblastoma, so it has some surgical option, and followed by chemotherapy, and some tumor like bone tumor, it has uh, Ewing sarcoma. It has all three modalities. We will treat by chemotherapy, radiotherapy, and surgery. So the treatment in the pediatric is the broad spectrum is almost same: radiotherapy, surgery, and chemotherapy. So it is a just a baseline of the treatment. So
So same
definitively,
kind of treatment is only being followed for the children as well.
yes, but protocol is different, and multi-modality treatment means only single doctor can't treat a single type of cancer. It will have by the surgeon, radiotherapist, and general pediatrician also will help. So this is the basic phenomenon.
Okay, doctor. Thanks. That's
Yes,
a brief explanation we got. So the next question: Do when it comes to children, will the dosage be? I mean, do they receive less dosage? And what are the side effects do they experience, like when compared to adults?
yes. So as per doses by in the pediatric, either it is cancer or non-cancer, most of the doses by weight or body surface area. Suppose that if I told one chemotherapy like vincristine, cyclophosphamide, it is the either milligram per kg or per meter square. So it is almost equal to the same body surface area. So in the but in adult, there is a capping dose. So we will not go beyond this. But in the pediatric age group, we can give according to the weight and body surface area. And now come to the important part, as you ask, side effects. So most of the chemotherapy, either radiotherapy, the basic side effect is uh, vomiting, nausea, poor appetite. These are the basic common things. But some sort of chemotherapy have very adverse reaction like anaphylaxis and hair loss is similar to the adult type. So the side effect is almost equal to in the adult age group. But pediatric age group, the poor appetite is very important, because in the adult we can ask the adult person to just eat something, but in children how can we go through that? So this is a basic phenomena. And apart from now, treatment modality is very advanced. So day by day, side effect of the chemotherapy or radiotherapy is decreasing day by day. So it is as safe as non-malignant disease like tuberculosis, HIV, and all the things. Because treatment nowadays is similar platform. Yes.
Okay, doctor. That is, thanks for answering it in a brief manner. So then, my next question, connected to the previous this question. So when the children they are receiving the treatments, like the treatments and the side effects. So generally, like adults, children also they undergo psychological stress.
Yes.
I mean, children that too they are exposed to they have to go to schools or they have to uh, they are surrounded by their friends or other people. So how do they experience and what kind of counseling or what type of counseling will be helpful for them in specific I'm asking.
Yes. So as per counseling part, if the suppose the children, the patient age is under 5 year age, then most likely he is in the home. So just basic paternal maternal care is important. But if the age is more than 5 year or around 6 year or between 6 to 10 year, so definitively the school dropout will be there. Suppose that in blood cancer, the treatment will be 6 months to 2 year. So in initial 6 months, so the child feel that "Ki I am backing his colleagues." So generally, home tuition, video classes, and basic counseling. Okay, don't worry if the patient is understanding. Okay, we will cover after the important treatment. Generally, in the pediatric age group, we don't disclose if he or she is understanding. He just told that it is a blood disease, and the parents know about the cancer, because nowadays in the mobile era, even 6 year old child know the all the YouTube, Facebook, Google. So generally for the kid, we just told that "Ki, okay, you are coming to the hospital every week or every third day, just for the blood checkup, like hemoglobin and all the things." So the patient will feel good. So generally at pediatric oncology center, there is a some play areas, some other activities there. So they
Okay.
feel very good, like similar in the school.
Okay.
So yes,
So that kind of environment has been is being created for them.
yes, social worker is there, so they don't feel any anxiety.
So, pertaining to this question, so in general, is it okay to not better not to reveal it to them directly, telling like you have been diagnosed with cancer, or
Yeah.
as you said, we can tell like it's a general blood checkup. How to reveal it to them actually?
See, suppose if the patient age is around 10 years, then gradually day by day he themselves known, because at the cancer center they read cancer center and blood disorder. So by
Definitely.
it, if someone is hair loss and we all talk to each other, then gradually they understand the things. It is important thing. But if the same time one patient new patient and one is the old patient, so follow up patient, so we just compare the things. Okay, see, you are now the initial part, this is the old patient, now he is fine, he is cured, his hair is growing, now you have just loss of hair, then after sometimes you gain it. So same time in the OPD it is easy, but in the inpatient we just counseling by some sort of films. Okay, this patient has come like you, and now he is okay. He is doing some good activity. He is player. He is now 10th class. So we are just comparing the thing, and if initially few days or few months we gradually say, but directly we can't say na if he is
Definitely.
the patient is understanding the thing, and after sometimes few weeks the understanding is better than the first time, so it is easy both parent and us.
So they will understand it gradually. That's what.
Yes, yes, gradually, not in a single sitting.
Yeah, definitely.
Hmm.
So my next question, doctor. So, I mean, for children especially, when these cancer cases are prevalent, so are there any vaccinations available for them, for children, in order to prevent cancer?
So at present nowadays there are hardly vaccine for the cancer prevention, because vaccine is for the to prevent the disease, not to cure the disease or treatment for the disease. Like cervical cancer, which generally occur in the adolescent female after 40 or 45 years. So in the female age group, after 9 year or 10 year, we can give the vaccine that called the Cervix vaccine.
Okay.
So only as I know, this vaccine is for to prevent the cervical cancer in the
Okay, which is
female
prevalent
age
among
group.
women,
Yes, but
female.
yes, but in the like bone tumor and all the things, blood cancer. So at present, as of my knowledge, there are hardly any vaccine is there.
So, in general, there like we get to hear like when the immunity of a person is very really good, it is
Yes.
not possible to get diseases and everything. So, what are some of the immunity boosting ways or foods which you as an oncologist, you have an expertise. So, please suggest some foods, doctor, like for the generally in specific for children to boost your immunity.
So once you have a cancer or any patient, so immunity is the important factor, because during
Definitely.
the cancer period or before the cancer period or after the post treatment phase, immunity is one of the part of the treatment, peri-treatment part. So suppose that we are fine in during the treatment, so definitively nutrition is equivalent to the immunity for the patient. So initially there are hardly, because poor appetite, they are not taking any the nutritional food. So generally we give the familial food. Suppose that someone is liking the egg or non-vegetarian food. So we just ask them whatever you like, just a home-based cooked food during the treatment and post-treatment part. But um after once the chemotherapy is completed, radiation is completed, gradually the immunity is recovering, and appetite is also recovering. Then whatever the normal food, not street food, street food 100% avoid. They will just increase the complexity of the infection. So home based food is best option. And in the fruit, the seasonal fruit is always have a better immunity than the costlier food. So something a common phenomenon in the Indians, the like pomegranate is very costly. It is red. It is more than 200 kg per kg. So it is more iron or more blood. It is not. The seasonal fruit, which is cheap at that season, is very immunity booster. Okay, non-seasonal fruit is just costly. It is not directly correlated to the immunity. This is the basic understanding for the patient and parents.
Thank you, doctor, for that.
Yes,
Yeah, definitely. As you said, generally we have a misconception that the foods which are costly, like
yes,
especially even the exported fruits and
yes, yes,
vegetables, people consume. People think like exported foods are they are very rich in nutrients and vitamins, and they
Yes.
consume it, ignoring the our native fruits and vegetables, especially the seasonal ones. But as you
Yes.
rightly said, the seasonal fruits and vegetables are very important, which should be consumed at the right time in order to boost your immunity and everything.
Yes.
Thanks for the
Definitely.
telling that, doctor. And
Okay.
my next question: what is the chance of survival for for children, because children are they are the future and they have to live long. So what are the chances of survival, doctor, for children?
So the if you believe in the mythology, so God is great. So God give the cancer to the adult, which age is around 45 year, 55 year, and the God is give the blood cancer to the pediatric age group, which is just around 3 year, 4 year. So according to the concept, the cure rate is more than 80% in the pediatric age group, whose age is around the 4 year. But same time, same type of cancer in the age group of 45 years, 60 years, the percentage of the cure rate is just below the 50% overall survival rate, which we called. So so I told this, God also want, if you I give some disease, then there is a chance of cure more than the adult. Okay, because the pediatric age group is innocent. They not consume the alcohol, they not consume the cigarette smoking. So this is just a basic concept which I already told to the my patient parents. And now come to the exact data. Suppose that someone have blood cancer, ALL or AML. So possibility of the cure is around 60 to 80%. Some nodular cancer like Hodgkin's lymphoma up to 95%. And now the modality of treatment is very advanced: chemotherapy, proton therapy, radiotherapy. So if we add on these therapies, the cure rate definitely will increase. So if we overall cancer like brain cancer, liver cancer, eyes cancer, blood cancer, a average of around up to 70% we can achieve for the betterment or cure rate for the pediatric age group. But definitively, some cancer are very notorious, very refractory, very
Mm,
hard to treat by anyone. So there are some cancer, but as doctor, definitive, if you have a bad disease, we have a good treatment. If we have a good disease, we have a more good treatment, more better treatment.
definitely, with advancements in the
Yes,
oncology field, there are so many researchers and so many medicines are coming. So at least we have, we should definitely thank the oncologists and the researchers that are going on
yes, yes,
to
definitely.
bring the care, and curable rate has been increased. So my next question, doctor. So what are the common types of cancers in children? And like, please tell us about hematology, the blood cancer as well, doctor.
Okay, fine. Brief discussion about this oncology and hematology. Both are same and both are different at the same point of time. Oncology means cancer, it is a blood cancer, solid cancer. In hematology, also there is a blood cancer, but it's a non-hematological disorder like thalassemia, aplastic anemia, sickle cell anemia. These are the hematology part, but non-cancerous. Now come to the point. So in oncology, the most common cancer in the pediatric age group is brain tumors. After that, blood malignancy like acute leukemia, ALL, AML, Hodgkin's lymphoma. These are around more than 70%. They just up to blood cancer and brain tumors and Hodgkin's lymphoma. Some rare tumors are like bone tumors, hepatoblastoma, liver tumor, adrenal tumor, neuroblastoma, Ewing sarcoma, and soft tissue tumor. They are the some rare malignancy. So this is a basic concept. So generally, every if we see 10% in one OPD, so out of 10, 7% or 6% will be acute leukemias. This is the incidence of the pediatric tumors.
Okay, doctor. Thanks for that. So, when you were telling about this types of cancer prevalent in children, so I have a question here. Like when it comes to brain tumor and retina, related retina, is it
Yes,
because like children who are about like 5 years, is it because of using more exposure to technologies like using phones, and is it because of that the lights and everything?
yes. So definitively, everything is have some etiological factor to the one disease. So, like not in the retinoblastoma because there are it is related to the genetic mutations. But definitely nowadays in the general pediatrician generally encounter that nowadays the behavioral change in the present scenario between the 3 to 4 5 year age, the propensity of the autism, behavioral disorder, all are now frequently every third patient or third pediatric OPD patient is encountered this. But direct correlation definitely radiation is there. So not now after achieving the adult after 40 years 60 years it will predispose to the cancer. But definitively TV mobiles they are highly radiogenicity. So one point is definitively we not avoid this.
So using the, so it's as you said, doctor. So it's good not to use give the telephones, I mean mobiles, or exposure of the technologies to the technical device, I mean electronic devices to the children at a young age, so that they will not be affected and they will have a normal
Yes.
healthy life as well.
So because we have no any data direct correlation to the these things that we have a data if we are smoking then definitively the chances of the lung cancer will be more. But definitively we just time. Suppose that if the child is seeing the YouTube all the things 5 hours 6 hours definitively refractive error just cut down 70%, 30 minutes 40 minutes he can use the mobile and all the things because nowadays both parents are working so we will give something so just cut down the percentage. Okay. Yes.
Yeah, so when doctor is telling this, I have just small tip to tell to the parents. So when both parents are working, instead of giving the mobiles or making the children sit in front of TV, enroll them for some classes. Let them go out and go for some classes and mingle with other children, learn something new, so that they'll have less exposure to the electronic devices, and parallelly they will also have more knowledge as well. So that is one small tip as a parent which I could tell. So
So
my next,
definitely,
yes,
mm,
doctor.
generally I told just 1 minute.
Yes.
आई विल कॉल यू लेट मैं थोड़ी देर में कॉल करता हूँ ठीक है 2 मिनट सो एक्चुअली पेशेंट father is calling.
Oh,
Okay,
sorry.
fine. So don't worry. Definitely, I generally told that ki nowadays parents is growing without any technology, without Google, without you and we are just
Yeah,
go at the same time without technology, without
definitely.
YouTube, without Facebook,
Social
and without
media.
phone.
Yeah,
So now we are fine. We have some work, but if the same time our kid or the parents who are seeing us if her or his kid is growing by mobile and without any activity definitively we lose more. If we both are working then there is a way half time the father will give to the child half time mother will give to the child and there is always there is a alternate apart from
yeah,
the mobile and technology and the Google.
definitely.
So Google, we are not going by the Google. We are going by itself our parents. So the same, your parent or who is seeing us, if their children will grow by parents or some other activity, it is always not better, always best for their kids.
Yeah, true, doctor. That is, you have rightly said, like there are definitely options available to divert the children, as you rightly said, doctor. So my next question, so the children, they are undergoing the treatment, as we have already discussed, they have in their growing age, they have so many activities to do, they have so many things to learn. So how will they be able to recover quickly, doctor? Like how to recover first of all after the treatment and everything?
See, definitively there is side effect of the anything, either chemo, radiotherapy, or surgery. But in the children, the recovery is very good. So some early side effect or some late side effect. Early side effect like vomiting, hair loss, it is will recover. But some definitively late side effect are learning disorder, uh, growth part, endocrine disorder. But if we entitle the sign like pediatric endocrinologist, growth monitoring, good foods, learning facility, all. So recovery will be almost equal to the normal patient. But some sort of definitively 5 to 10% will not recover. But if we use the recent advances, regular follow up, so then recovery will be fine.
Yeah.
Yes.
Yeah, thank you, doctor. Then now the last question. So the bone marrow transplantation, please tell about it, doctor. And is it available for the childhood cancer?
So the definitely nowadays fancy things are upcoming, bone marrow transplantation, proton things. But at present in India, um, the bone marrow transplantation is not new. So some type of cancer like high risk cancer, high risk ALL, high risk AML, refractory Hodgkin's lymphoma, neuroblastoma, there is a facility of the bone marrow transplantation. Bone marrow transplantation is a part of treatment modalities. It is not an operation, it is not a surgery. Like chemotherapy, radiotherapy, blood transfusion, and bone marrow transplantation. It is a next advanced treatment. There is no organ replacement. If suppose that we are doing the stem cell, it nowadays it is not a bone marrow transplantation, it is a stem cell transplantation or cellular therapy. So if the donor is available, so then for patient, for his her or his brother, father and mother, both can become a donor. And it is just some basic procedure is there. Nowadays, in almost every city, bone marrow transplantation is available. In Uttar Pradesh, at present, Apollo Medics Lucknow is starting the bone marrow transplantation. Firstly, private hospital in the UP. In Delhi NCR, there are many centers, private or government, which is already started. At present, we have a good facility or good team for the doctor, adult and pediatric me, which are trained and almost did the more than 100 bone marrow transplantation. So at present, it is not a far away for our kids. We can do easily. The complication will be less, and the funding will govern by the government, either CM funding, Prime Minister funding, or some crowdfunding, as we know very well. So if the patient know the disease or parents know about the or we know about the aggressiveness of the disease, definitely there is a treatment. No treatment is not good. Some treatment is always better.
Thank you, doctor. So you have
So,
answered all the questions for the past 40 to 45 minutes in a very detailed manner. I know like you are so busy today, and in spite of that, thanks for coming to the talk show and I mean, spreading awareness, more awareness about the pediatric cancer, which is also increasing in India. So thank you so much, doctor, once again for coming here.
and I also thank you for you to initiate this platform. It's good for everyone. Thank you.
Thank you,
Okay,
doctor.
thank you. Good.
Thank you so much. Yeah.